All right, all right, Renee, thanks so much for taking the time to do this. If you could
Yeah.
tell the audience a little bit about yourself and how you started in the world of psychology, that'd be great.
Oh, it's I'm trying to think how to make it a short story. I I've, I've always thought people and how we think and relationships and all of that have always been interesting to me. And psychology is such a good vessel for that. That the it just started out as interest and then ended up being an area in school that I liked and enjoyed and liked reading and writing about because those are my two, I would say, high interests. And so, yeah, it definitely was a lot of contributing factors. And because I have like my mom was very interested in psychology, so always worked with young people. And so I helped her when I was even like 10 at the school she worked at. And then just kept my interest alive in that way. And then, yeah, I don't know.
Hmm.
I'm not sure how to narrow it down.
Oh no, that's okay. No right or wrong answers. So tell me a little bit about the work that you do. What's the day-to-day like?
Um, well, the last like 12 years, maybe, well, over 10 years, I've been doing private practice, mostly of private practice, uh, relational counseling. Sometimes it's with individuals, just kind of trying to learn about themselves, but then also with families and with young people. So a lot of adolescents, and then also working with couples. I do a lot of couples work because it's a lot of relational therapy and systems work. And then I'm also teaching at SPU sometimes, like psychological disorders or adolescent development. But that's with the undergrad program and then psychology program there. And I worked for a long time. I worked at, they're closed now, but they were called Seattle Children's Home. And it was a huge resource to kids, one of the few resources to kids in King County who were going through a lot. And so I worked there for a long time before I went back to grad school and learned so much about relational and systems therapy. So it helped really working with adolescents and their families a lot. It was made it far more successful, or just like it helped a lot in working with young people having that systems background or MFT. So my degree is in marriage and family therapy. So even when I'm working with individuals, a lot of it is just about them um, and the systems in their life, like school, socials, just planning life or kind of transitioning in stages. Because I spent a lot of time working in colleges in their counseling centers. Um, and so doing a lot of counseling with that age group too, like young adult age group. So I've always really liked working with young people. There's a lot going on and a lot of stressors. So I like to be a help there or support.
Yeah. My next question is, what sorts of methods or approaches do you use when working with patients?
Oh, I could talk about that forever. But I will try not to. Um, well, it totally depends on the person and what they're coming in to talk through or what area they need support in. So, like an example, like if I see a young person, so like adolescent, young adult, and they're having a, trying to think, like maybe a hard time in school around social stuff, or just like not wanting to talk much or not socialize, or maybe wanting to, but not really like knowing how to like break that ice or
Those
whatever
who
is
are
going
kind of
on.
shy. Yeah.
Yeah, yeah. Like I like if I'm using that MFT, like that systems lens, depending on the person and what it is that's going on with them, we'll just talk through like either their past experiences in social situations or what was modeled for them in their own family or in close circles of support or caretakers. And then we would talk through the emotional component, like what gets activated. Because some people are more introverted, and then some people, which is a good thing, And then, but sometimes it's hard to know how to sort of restore the introvert part of someone and then also have social times where they feel comfortable. So just identifying different areas of need and a little bit of psychoeducation. And then there's a bunch of theory, like I tend to use, that's very family systems oriented. Um, but yeah, like sometimes people will come in with anxiety or like depressive symptoms or be at risk of self harm. And so then we're using different approaches. So it totally depends on the person.
Yeah, because I remember I had a time in high school where I was really introverted, kind of closed down, but when I
Yeah.
went to college, I kind of slowly started to talk to people, started to become more extroverted, and I felt kind of more comfortable doing that, you know?
Yeah. And it is like sometimes it's just like building that practice up and just also that high school chapter, there's so much change. There's just so much growth through that I feel like college is definitely a different environment, but similar and supported.
Yeah.
So that's cool.
My next question is, you said that you also taught students at a university, so I'm wondering if you could talk a little bit about that, what sorts of things you teach your students.
Well, I definitely the adolescent development course. I mean, like, how in college, if people are doing a psychology, well, a lot of different majors will require someone to take like a life development course. And so, adolescent development, it's a short chapter, but it's an intense one and it's formative. And so that has been a huge focus of like education for me or educating others. And then also psychological disorders. Like it used to be called abnormal psych, and they've changed the language around it to psychological disorders, which is just basically going through all of the DSM and just talking through the different, because to me, a diagnosis is less a label. Sometimes it's helpful to have a diagnostic label, but more so what it really is just a certain amount of symptoms. And when those symptoms present, then it's like a sort of category that can help people figure out what area do they need help. And so that's a lot of what I teach in that class, just the diagnoses and symptoms and things when it relates to the diagnostic manual or the DSM. And then I also do supervision. And so I've done like a practicum course or a faculty for that, which is the grad program or the graduate program for or marriage and family therapy. And so that's like the supervision piece. So like that, I'll have interns at my work where I'll do supervision. Oops, sorry. I tried to silence my phone, but there was like an interruption. Anyway, so I do supervision with therapists, other therapists who are students. Sometimes they're students like getting their master's in counseling or therapy. And then sometimes they've already graduated, but they're working towards licensure. So we'll talk a lot about like caseload and like people that they're working with and collaborate. I feel like that's partly teaching, doing supervision with other therapists, but it's also collaborating with them and just like, it's part of the requirement to get licensed, but it's also I learn as much as I hope the people I'm working with or doing supervision with are learning, because I think it's a collaborative relationship, like a peer uh, you know, uh, work. I don't know. I love supervision, like with students and grads and stuff. It's just always super interesting.
hmm You talked a little bit about the about the diagnosis piece, because
Yeah.
I have a younger cousin who is autistic,
Yeah.
and she's exhibiting some sorts of symptoms that portray autism, um but aren't really definitive. She's
Yes.
getting tests, she's getting all these sorts of studies, but then doctors don't know, aren't sure how to diagnose um her with autism. So my question to you is, what are the definitive factors that can really determine whether someone has a diagnosis, because I can tell you that my younger cousin, they're doing all these sorts of tests to confirm that she's autistic, but aren't really sure whether or not to do it because they might need more tests, blah 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 blah. So I'm
Yes.
wondering what your take is on that.
I think it's definitely complicated. And it's like that term, I hear it a lot now, multifaceted, like where there's so there's so many different pieces. And when it comes to, I would definitely say, definitely with autism and with a lot of different diagnoses, it is definitely a science, but it's an imperfect science. Just that in that having the more people on board, like that the patient or the client trust, like who works with them or their family, who does really thorough testing. Sometimes second opinions are helpful, and having more people on board who will collaborate and support and prioritize the patient or client, the better. And having like a talk therapist, which I mean, I'm biased, right? Because that's what I do. But like having someone that person can talk through, like, or family, like, and depending on the age of like your cousin or whoever the person might be, like having someone to talk through how they're feeling, like what their insight is, because their someone's own observations are very helpful. And then also having the interesting thing I would say about autism is it is a spectrum for sure. And the language is slowly changing. Like when I was working with kids, like I didn't have my master's yet, but I was a residential counselor. I'm working with them all day from like when they'd wake up to when they'd go to sleep. Um, I remember when the psych community was talking about taking, oh my gosh, my brain is totally blanking. Uh, they used to call it the high functioning autism, Asperger's. They were talking about taking Asperger's off the books, which they did do. And I just remember listening to all these clinicians like arguing for and against. And it was so multifaceted because it was like all these people whose kids, families, whose kids were in that category were suddenly going to lose funding and support from insurance. And then it also, though, was minimizing, well, it was just this whole big thing, like a big change that I didn't have control over because I don't do assessing and diagnosing for it. But it's just what I learned is just that the field is constantly evolving, especially around like labels, diagnosing, the definitions of. And sometimes, well, oftentimes, I think it's hard for medical professionals to like pinpoint certain things. And having a psychologist who does very, very comprehensive testing, and which is usually really expensive. So even just getting diagnoses, really what it does sometimes is gives people access to care. So it's this whole system. And I'm a systems therapist, so I see a lot of things as a system. But having like a diagnosis, then it goes in the charts, then it can go to insurance, and insurance has to pay. Or schools, like if people get private assessing, and then the testing, like psychologist testing, has a clear diagnosis, people can give it to schools, and then they can get an IEP or a 504 and get supports in the schools. So if you don't have a diagnosis, insurance and companies and systems, academic systems won't pay for care. So it's an interesting, like, it's a complicated thing. And so at least for me anyway, working with people when it comes to any kind of diagnosis, I tend to be more curious about what is it? Well, depending on the person, the age, kind of where they're at, and how talkative they are about this topic, because some people have no interest in talking about it, which is fine. Um, but sometimes I just am way more curious about how is that person feeling about all of these, whether it's testing or messages they're getting from school or from family or from doctors or the medical community. And it's super complex because when somebody says this is the diagnosis. It can sometimes become someone's identity, and sometimes that's a good thing. It's like a tool and it accesses all these things. And sometimes people feel all kinds of different ways about a diagnosis, especially young people, because it's such a high point of development from like, I don't know, little and young, like what, 9, 10 to 24, 23, 24. It's so much about identity and self identity. And we get so many messages from our world outside of us and within and in our families. It's just super, I just like processing that part with people. Sorry,
Yeah,
I have
and it's
really
all
long answers.
and it's also like especially if one is a first-time parent of a person with autism or any color diagnosis, they don't they just don't know how to because they're always asking for answers.
Yes.
Yeah.
And it's
Um,
hard when there isn't any, or when it's hard to get answers. I work a lot with families who are struggling with just getting answers because it's
yeah.
hard. Yeah.
Yeah, I bet. If I could move on, what impact does your kind of work have on the greater community? What sorts of, doing this kind of work, what do you hope to gain from like doing this?
I think like those, I'm like, how can I make that a short answer? Well, I think I've always liked working in the community I live in because I've just found that helpful. And I know some therapists intentionally have an office space that's a specific distance from home because they don't want to run into people. Whereas I've worked on campuses or worked in places where I run into clients or I run into people and even in that first session, I'm like, well, if I run into you, I won't say hi, but if you say hi to me, I would totally say hi back. Like it's a whole I live in my community and I have raised kids and I'm raising kids in my community. And if I learned anything during the pandemic, it's that there are not enough, it seems like there are a lot of therapists, but there aren't enough maybe that work with young people or adolescents or work with family systems or couples or do in person or have like an in person option for therapy or there were just some needs after, like during and after the pandemic where I was like, how can I help more people? Because you can only see so many people, you know? And so that's how I ended up I'd always been interested in supervision and doing that, but I was like, wait, if I supervise people and I have interns and they're learning, and I know that they're learning like the skills that I would love to have support the community I live in. Cause like I live so close to my office and my kids' schools, and just I'm really involved in volunteering and things like that. That I want to help everybody, obviously, but I do very much love that I have like at least a little bit accessible resource in the community, just because like we have either sliding scale options or like interns, it's not as expensive. And so people can have like a private practice sort of experience where they can just talk for an hour and it's pretty straightforward to get in and it's really close to the schools. So like adolescents can come easier, like after school or something. It just feels like it's making there are things that I'm trying to do to make it more accessible. That being said, it's a small practice, so it's not like 30 therapists. There's only a few of us, but I just like being here and having a resource that if people need it is at least around. Um, yeah, so hopefully that's helping the community. We'll see.
Yeah. To kind of wrap this up,
Yeah.
what can people take away from this conversation? How can this type of work really help improve people's lives, who are struggling? And this is a two-parter. What can future psychologists who are trying to enter the psychology realm, what advice would you give to them to sort of say, to prepare them for this challenging and demanding field? Uh, you can pick whichever question you want to start with.
Uh, oh, Well, I'll start with this. You might have to re-ask the first one, but with the second question, I would definitely, if I could recommend to anyone, even just interested in the psych field, is shadow, shadow, shadow. Like if people can find or interview, or ask, or like I know I called randomly some therapists that I liked their approach locally and was like, "Can I just ask you some questions?" And a few people were like nice enough to be like, "Sure, yeah." So I asked about like different, like, because there are so many different areas of psychology. Like there are psychologists, psychiatrists, marriage and family therapists, mental health counselors, social workers. Like, I mean, there are so many. It's a lot. And so, but they all have a different specialization, which I find fascinating because there's a need in all of those. Like, I'm so glad there are all those resources. I mean, I don't think of it as any type of like, oh, this way's better than that way. It's just that some things fit people better. And I think working in the field for like, I don't know, over a decade before going back and getting my master's helped me so much because I was like, "Oh, I love talking to a person, but they're always a part of something bigger." Even people who are just basically keep to themselves, they're always a part of something bigger, whether that's through work or whether that's just being a part of the community or being involved in any area. There's just people always are tied to other things, or even just their own family history, whether the family is still around or not. Like they're always a part of them. And I just working with people in that systems framework I've always loved. And so depending on like if I was talking to I don't know, like a freshman and teaching some class and this was their first psychology class. Like last year in the adolescent development class, I had a couple guest speakers, like a school psychologist and a young person actually who does like mental health speaking engagements and stuff, and then a psychologist. And so all three of them active in different areas of the psych field, just because I wanted those students or undergrad students to know like oh, this is what it might look like or be like to work in that field. And then shadowing that, because it's always good to work in an area that feels like really like resonates with the person interested in psychology. So I would just highly recommend that. Reading a lot, learning a lot about the different areas of psychology, um, and just talking to a lot of people if they're able, whether that's teachers or academics or counselors or the doctor. Like I shadowed a doctor once, and that was super interesting because I learned so much. So I don't know if that answers that question.
Yeah, that answers that question. And my first question was, how can this type of work, you work as a licensed mental family therapist, how can that sort of, make a difference in people's lives for those who are struggling, going through some tough things?
Yeah, I think that's very hard to make short, but I would definitely say there is a part of I think I've found it so helpful working with people in that people don't always go to therapy to talk about like a really specific thing that's a lot of people are like, oh, people go to therapy to talk about problems, which is definitely sometimes true. But sometimes through talking to them, we can find like in all these systems in their life, some of them are positive and a strength or a source of support. And then sort of folding that into maybe the challenging part that is bringing someone in. I've just found it a huge resource in if someone's struggling right now in this moment, we can often tie it into other areas that help answer questions and help people find peace or kind of settle some stressors or bring anxiety down. It's so vague. Like there's like specific issues that are really helpful um, things to teach people or work with them or just that they can identify in their own lives because the client is the expert. I'm just helping kind of guide them in areas or ask questions that'll help them go, oh, I hadn't thought about it like that. Or, oh, that's really upsetting. And we can like process it and have a space where it's, people can talk through their feelings and resolve some pieces. Yeah. Anyway, obviously, I love what I do. And so I'm like, oh, it's the best. I could talk about it for hours.
Yeah, but and also like I was talking to a friend about this the other day, and she said, when I go to therapy, I try to find someone that kind of connects with me, that kind of
Yes.
resonates with me, because like she told me one time that, you know, um, I see a female therapist because, um, from her perspective, she would like to feel seen and heard. So
Yeah.
yeah, that's another thing I took away.
That's a very, very good takeaway. Because if I could make, if anyone's ever looking for a therapist, the biggest recommendation I can make is if it's at all possible to even have like a phone call with that therapist and ask, like, what's your approach? Like, what kind of a lot of stuff that you're asking me, like, what's your background? What made you get into therapy? And hopefully that therapist will talk through it, because even from like a 10 to 20-minute phone call, people can get a sense of fit because they can see, like, oh, this person is a little bit lighter when I'm talking, or oh, this person is very quiet and has very short answers, because just like people, therapists are very different. And so fit, like some people just need to be able to talk and they don't want or need a therapist who's going to talk a lot. And then some people want a therapist who like has a lot of homework or is like, well, tries to keep them accountable, or like is you know what I mean? And then some,
Yeah.
I might talk too much, but I try not to. Some people are like, oh, but I want to talk, I want to hear ideas. So yeah, definitely your friend is spot on. Therapeutic fit or clinical fit is, I think it's huge, or it helps.
Yeah, I bet. All right.